Hi, hello, this is Dr. Cidambi. I'm here today to talk about a very interesting topic, which is chronic hallucinations. Chronic hallucinations are hearing things that are not there. Or you might think, how common is that? You'll be surprised to hear that there are so many people who experience this and they are living with it. So how to cope with chronic hallucinations is what we are going to focus on today. So these chronic hallucinations, meaning this is like something we need to have a structure. It's not like you're rolling out of the bed and, snoozing the button. Like it's like 60 to 90 minutes of, morning routine. So it's a commitment. It makes a huge difference. So use a sunrise alarm clock instead of the jarring alarm clock that can really, strive a day, starting your day on a wrong foot. So the jarring sound could be even more disruptive for someone who's hearing auditory hallucination. So gradual wake up eases you into the day, and then incorporating physical activity, even some light yoga or stretching, anything to get this endorphin flowing will prime your body and mind. So who wouldn't like to have a little yoga in the morning, right? Even without hallucinations, it's a pretty ideal thing to start your day with yoga. So mindfulness and meditation is a vital part. It's a key component. So you would wonder, how is this really, these practices specifically help with auditory hallucinations, right? So you got to think about it, right? If you're constantly hearing voices, it can be incredibly difficult to differentiate between what's real and what's not. So it all kind of blends together. So mindfulness and meditation helps you train your mind to observe your thoughts and feelings without judgment. You're basically creating a safe space. It's a space between self and the hallucinations, which gives you a greater sense of control. So the most important thing is journaling. So it is important to journal. It's so powerful. Journaling is so powerful. By writing down your experiences, you start to noticing a pattern, or there's certain times of the day when the hallucinations are more intense, or specific situations, specific triggers them. So you become a detective of your own mind, gathering data to help manage your day. That leads perfectly into structuring a daily schedule. So this most important thing when you talk about scheduling is to breaking the day into a manageable small chunk of time. So these are all logical thought process. Why is the structure so crucial, specifically for someone who's dealing with auditory hallucinations? Because when you're dealing with hallucinations, even the simple tasks can feel overwhelming because your brain is already working overtime. So by creating this real clear roadmap for the day, you're minimizing that cognitive overload and making it easier to stay on track. So it's all about creating the structure to deal with the chaos. So designating a hallucination-free zone, it's a quiet space where you can retrieve things when it gets overwhelming. So this quiet space, this knowing that you have a space where you can go to regroup and reset. It's a safe space. So it really, that's where, we are going to talk about coping strategies. There are so many practical techniques like grounding exercises. So the grounding exercises, when I say that, imagine you're feeling super anxious and the hallucinations are getting really intense. So the grounding technique will be as simple as focusing on your five senses. So you could focus on the coolness of a glass in your hand, the texture of a soft blanket, the scent of a candle. So you're bringing your attention back to your physical surroundings and you're anchoring yourself to reality. And then there are also distraction techniques. So when I say distraction can be like anything that shifts your focus away from the hallucinations. It could be as simple as listening to music or watching television. It can work for some people. Or going for a walk, engaging in a hobby, doing a puzzle. It's personalized, it's really to find a key activities that you can enjoy and it can effectively absorb your attention. And it's also reframing is important. During hallucinations, reframing is a key element there too. It's a shift in perspective, shifting your mindset from one fear and helplessness to one which is powerful. That empowerment, feeling of that empowerment is also tying with the support network, where you have support group, friends, family, where you can talk about your experiences. Makes a huge difference. Speaking about chronic hallucinations, like identifying triggers is very important. What are the common triggers that people might experience? And when we say triggers, it can be different for different people. So lack of sleep, stress, certain environments, even specific people. So when you pay attention to what really triggers this auditory hallucinations, once you know your triggers, you can start developing strategies to minimize those. So that's where the relaxation techniques come into play. So deep breathing, meditation, progressive muscle relaxation, all these things can be the coping mechanisms. They can help regulate your nervous system and calm your mind, which in turn can reduce the likelihood of intense hallucinations. So it's like having a toolkit of techniques to use depending on the situations. So that's a great analogy, right? So the evening routine, like you can, we looked at the morning routine and winding down gradually, maybe by reading, reflection, journaling. It's all about preparing for a good night's sleep, which sets you up for a better tomorrow. So it's important to emphasize that this plan isn't meant to be a rigid set of rules. It's definitely not. Everyone who was experiencing auditory hallucinations will be unique. So what works for one person does not work for others. So you need to find your specific trigger and the coping mechanism. It's not a race, it's a journey. Definitely there will be good and a bad, good days and a bad days. So you need to turn to the professional help. So it will help you with this journey. To wrap things up, we have really explored a lot today. We talked about how structure, routine, mindfulness practices, coping strategies, and trigger management can all play a huge role in living a fulfilling life, even with a chronic auditory hallucinations. So it is pretty inspiring. And so if you're dealing with this, one small change, even if you try one small change and if you incorporate it into your day, one tiny thing, to get started, it's as simple as starting a journal or practicing a few minutes of deep breathing every day. Start somewhere, and designating a quiet space for yourself, creating the space between you and the auditory hallucination. And, that's a major thing and can make a big difference. So, true to be said, I would also recommend that, at least start off with ragas, R-A-G-A-S. These ragas, instrumental, go after the instrumental ragas And there are ragas designated to the time of the day. There are morning ragas, afternoon ragas, evening ragas, and night ragas. Just playing those ragas in the background of your environment, starting from the time you wake up till you go to bed, even that is a good start, and you would start making tiny differences, and then you can incorporate everything that we spoke in this video. On that note, I would like to leave you guys with a deep thinking of how to help your loved ones or yourself who are experiencing this auditory chronic hallucinations. Bye bye till my next video. Take care.